If you are somebody who is considering going on testosterone replacement therapy, aka TRT, these are some things that you really want to consider. These are things I talk about with all of my private clients. Number one is you want to do bi-weekly injection. And the reason why is this best approximates regular testosterone fluctuations within the body. Number two, the higher up your testosterone goes, the more increased risk you have for a higher hemoglobin and hematocrit, which essentially is your blood becomes more viscous. It becomes more thick, and that can lead to an increased risk for blood clotting. Number three, if you do decide that you want to come off of testosterone replacement at any point, it is going to be much harder if you are at a really high dose and you have to come down versus a relatively normal dose and you have to come down off of that. And finally, the third thing you want to keep in mind is that you should be testing regularly. I like to monitor labs every 4 to 6 weeks to start, just to make sure we are in the optimal range, and then also making sure that we are getting the right labs. This means getting a total and free testosterone, but also sex hormone binding globulin and estradiol. We want to measure at least those things along with a complete blood count, and that's where we're going to look for that hemoglobin and hematocrit elevation that we have to be careful.